Good afternoon, everyone. This is Sumi Lee, Western Sydney University Nursing Course third year. This is my ID. I'm going to present about case study assessment 2. I'll be presenting on the implementation of a culturally safe healthcare for children and adolescents using the case study of Lin, a 14 years old Vietnamese Syrian girl undergoing treatment for acute lymphoblastic leukemia. Lin and her family speak both Vietnamese and English, practice Buddhism, and hold strong beliefs around the modesty, health, and family involvement decision making. Lynn is a confident girl but has expressed anxiety about the chemotherapy-induced changes to her appearance and discomfort with hospital gowns that she feared compromise her modesty. My presentation will focus on how culturally safe care can be practically implemented in this scenario. The first, I want to define about cultural safety and interprofessional collaboration. The cultural safety is the practice of delivering healthcare that acknowledges, honors, and attend to patients and their families' cultural identities, value, and needs is known as cultural safety. Midwives and nurses will also evaluate care considering their own cultural value. People from diverse cultures may have worse health outcomes because of culturally sensitive healthcare, which can also limit access and engagement in services. And interprofessional collaboration, when several healthcare professionals collaborate to provide patient-centered care. This is referred to as interprofessional collaboration. To change patients' behavior and their attitude, knowledge, and ability to manage their health, and patient education is necessary. This improves diverse symptoms and lessens the need for additional medical interventions by encouraging patients to follow their treatment plans. This partnership guarantees that the child's and family's cultural, physical, and emotional requirements are successfully satisfied in a hospital setting. The next is the how cultural safe care promote health and well-being, preserving modesty and dignity. During therapy, letting Lynn wear different dresses or cover up can help her feel better about himself instead of just wearing normal gown. And the second is promoting mental well-being. Lynn finds it easier to handle therapy when her worries about hair loss and the physical changes are addressed through culturally appropriated counseling. And third is the cultural responsiveness. This is important because building trust and lowering anxiety can be achieved. For instance, by recognizing the family Buddhist values and include them in is very important to them. The factor affecting implementations. The first three are the concern about the hospital procedures and rules that might not permit family participating in decision making or modesty. So it is important to keep the flexibility in hospital practice, including changing the gown or implementing privacy measures such as her own gown, engagement of the family in care planning and decision making. And next one is can be a step lacking awareness her family's culture in cultural safety. So staff should be trained in culturally safe practice, and the family-centered care are really important. Yeah, next slide about the professional colleagues and rules. The firstly, the medical team, which is the pediatric oncologist. They explain treatment options to Rin and family and involve the family in decisions. The second is social worker. The social workers provide resources, support the family dynamic, and help navigate culture, which is Buddhism, or financial challenges as well. And next is school teacher and the hospital school program. It helps her continue education while she is in hospital. And next one is pharmacist. They ensure the safe chemotherapy dosing and explains medications to child, lean, and family. And next one is psychologist or counselor. They help with her anxiety, depression, and body image and appearance concerns adjust to illness. With play the professionals, psychologists, and educations of offering care that is considerate of Lean's cultural values and age-appropriate requirements. This partnership goes beyond medical therapy to take emotional and social welfare into account. The multidisciplinary team protects Rin's identity and dignity and family customs, regarding all of which are critical for trust and healing, while also tending to her physical and mental well-being by incorporating cultural safety into every contact. So conclusion. So children and adolescents from a variety of culture and linguistic origins have special needs, which are recognized and met via culturally safe healthcare. Berlin, this entitles the acknowledging the importance of her family values, Buddhist beliefs, and Vietnamese culture in her care. Her voice and cultural identity will always be at the forefront of her healthcare journey if her privacy and modesty are respected during treatments. Interpreters are used when necessary, and her family is involved in all decision making stages. Since teenagers receiving cancer treatments may struggle with worry, fear, and body image issues, emotional support is just as important. Counselor, physiology, and play therapists can offer age-appropriate coping mechanisms to assist Lynn in managing the social and physiological psychological effects of her condition. In order to achieve this cultural safety, interprofessional teamwork is essential. Together, pediatric oncologists, nurses, nutritionists, social workers, spiritual counselors, and educators provide comprehensive family-centered care. The healthcare team guarantees that the RINS care is not only medically effective but also culturally aware and emotionally helpful by exchanging, acknowledging, and honoring the specialization of each profession. Throughout RIN treatment, and this cooperative approach protects her dignity, foster trust between the family and the medical staff, and improve her general well-being. Thank you for listening my presentation.